Good afternoon, everybody. This presentation is for the Applied Counseling Theories course, EDCO 715. And this discussion will be based upon the Contemporary Theories presentation. With this, I would like to go over the central concepts of what the theory is that I have chosen and what exactly this means. So the central concept of cognitive behavioral analysis systems of psychotherapy, also known as CBASP, was completed by James P. McCullough Jr. in regards to supporting individuals that are dealing with chronic depression. McCullough in 2013 indicated that CBASP integrates cognitive behavior therapy with interpersonal and psychodynamic theories and strategies. Klein et al., in 2011 indicated that the central element of treatment for CBASP is a situational analysis, which is a highly structured, multi-step interpersonal problem-solving task through which patients learn that their behaviors have consequences and how to relate functionally to others. And so with this means that there may be a breakdown or a discrepancy in how other people are able to engage with others. And when this occurs, it can be surmised to say that over a course or a duration of time, depression can set in and can continue to perpetuate itself as there continues to be a breakdown in this area of how others are able to engage with others, which may be led to having maladaptive behaviors in how they interact with others, thus perpetuating the decline, which could be cause of chronic depression. Also, Keisler, 1983, stated that situational analysis includes behavioral training in the form of role-playing, interpersonal complexum model used as a supplemental interpersonal strategy. And so this is a way to help people identify the areas in which they are having struggles relating with people interpersonally, and then to break the cycle so that they can have better and more well-rounded interpersonal relationships. It is also reported by Casas in 2009 that when patients do not respond adequately to antidepressant medications for chronic depression, clinicians usually adapt the strategy that can be related to our theory of today, which is CBASP. They do this in a number of ways. The first way is by switching medication, augmentation, and adjunctive medication, or adding psychotherapy. It is known to be stated that psychotherapy in conjunction with medication can absolutely help a person to be able to decrease their maladaptive behaviors and as well to have a more quality and wellspring of life. With this, I want to go into the factors of what causes the dysfunction. And according to Judd et al., 1998, this dysfunction is caused by negative thoughts, which leads to negative behaviors and patterns that can cause depression. I surmise it to say that these thoughts, or the negative thoughts that a person have, causes a person to spiral into negative behavior patterns that can create dysfunction in the quality of their life, but it can also stifle productivity in a person's life. I also wanted to state that this treatment or this therapy, CBASP, can also work with those who are diagnosed with major depressive disorder, according to Judd et al., 1998. It can also support those that have persistent depressive disorder, according to the American Psychiatric Association from 2013. And it can also support those who have chronic depression, according to Kasi and Fava in 2013. I also want to take a moment to also indicate that Paget, 1993, 1926, 1967, and 1981 constructed that pre-operational thinking provides an excellent means to describing the criminal thoughts and structures and language patterns of those that are chronically depressed as adults. With this, it surmises that excuse me, that CBASP hypothesizes that chronic depression is a developmental disorder leading patients to think, believe, and talk like a 4 to 6 year old pre-oppositional children in a social interpersonal area. And what this means is that when a person is having chronic depression, their thought patterns, their behaviors, and the way they speak all become redundant into a former state of being and knowing and understanding. With this, Paget also goes on to state that chronically depressed patients perceptually are entrapped in the present moment and unable to extract themselves perceptually from social interpersonal events that always are construed negatively. So the key word here is negative. There's always a negativity. There's always a downside. There's always something that is the opposite of what could be therapeutic and wholesome that is residing within a person. It also goes on to state that unable to disengage themselves perpetually from this present moment, a thinking and language ability requiring the use of formal operations of thought, chronically depressed individuals are caught in this intractable worldview, which is a worldview that is not influenced formally by environmental reactivity, according to Paget, 1923, 1926, 1967, and 1981. And so it is here we must understand that this dysfunction that's being caused is that it allows a person to not be able to function within their present day, but that they are reminded of a former day. And so their thinking, their language, how they respond, how they react is all related to how they would previously react, aside from this present day moment. So for an instance, a person can be in their 30s and their 40s, but when an incident comes that they are showing signs and symptoms of chronic depression, they end up reverting back to younger years and having an inability to be able to formulate words and sentences to which can help them to come out of this current present state, so that they can be able to move forward in a more productive way. Now I would like to talk about the nature of the therapy for this matter. And so with this, I wanted to indicate that McCullough, 2003, indicate that the treatment must begin on a more basic level. So it cannot be something that is highly educational per se in regards to the language or the linguistics or the structure of it. But what he is saying is that it has to be basic, it has to be more simplified. And so he says psychotherapists must teach patients to think in formal operations terms over time using repetitive structures. And what they do by this is that they simplify to help a person understand where they are, what they're thinking, what they're feeling, so then that way they can now begin to speak and express what they're thinking and what they're feeling, so that they can move out of those pre-operational forms and move more into a present day form. I also wanted to indicate that that McCullough also indicates that successful CBASP therapists is not a simple undertaking. He indicated that this is for two reasons. And the first one is that early onset persistent depressive disorder, or PDD, presents a unique and difficult challenge to practitioners. But secondly, that CBASP clinical's role is qualitatively unique because it is given in combination with the techniques as well as the requirements for the therapist. So here we see that for the therapist, it is more multi-stepped approach. to support the person that is having this diagnosis or this issue. However, the technique and the methodology for the client should be simplified. It should be not convoluted, but it should be able in a way that a person is able to step by step navigate through this process towards their wholeness. I now want to talk about some of the roles of the client and the counselor. With this, we must understand that the counselor's role is directive. And what I mean by directive is that the therapist comes from an educational standpoint to help the client understand educationally what is going on at the moment within their minds, within their hearts, within their behaviors. It is also to state that this theory is not passive, but is active. Active in a sense is that it engages the client to be able to bring forth information to bring about the holistic well-being of the person. It is also here that I want to quote McCullough 2021, which says the best and most effective CBASP therapists over the course of time fall into 4 specific categories. The first one is the ability to enact a disciplined personal involvement role with the patient. So again, there is involvement, there is activity. This is an active and a directive approach. The second piece is that the therapist is able to implement an acquisition learning approach to therapeutic administrations. And this means that there is a learning that is involved by the client. So it's not the therapist giving the client all the answers, but it's a learning process in which the client begins to try to understand and learn and process what's going on with them behaviorally in their thoughts, so that they themselves can begin to reverse some of these negative patterns that are occurring in their life. The third thing is that the therapist is able to adhere to the standards that are applied within the administration. So what this means is that there's a strategic pattern that goes with this specific course and not something that's done off the fly of the handle. And so with this, as the therapist is able to follow those methodologies through the administrative process, they are able to direct their clients into a more holistic pattern of positive thinking, therefore allowing them to be able to learn more positive responses or behavioral patterns that will then allow the client to be able to go into the mainstream of the world with a better point of view. Lastly, McCullough 2021 indicates that the therapist must have the ability to implement several facilitative interpersonal skills. And because of the fact that this is a deficit in the interpersonal relationship, the therapist must also be skilled in being able to help the client to know how to rework those interpersonal relationship skills that they're going to need and use once the therapy session is now over. In this, I also want to report that Netter et al., indicates that the person is the historian. So the person is the one that gives the information in regards to what's going on as far as the assessment pattern. And not only is the historian, the historian, they are also the historian for themselves, but they are also the historian for the significant other relationships, meaning that this person will now give an account of how they interact with other persons within their relationships. I also want to indicate here that there is also a unique picture of psychopathology that unfolds in this concept, according to McCullough 2021, as he indicates that the therapist listens carefully and observes the way the chronic patient talks and behave. A lot of times we know that we are able to glean information based off of what a person says, but sometimes we have to look beyond what the person says. And sometimes we have to look at what the person is not saying, or how the person's body language is speaking to us as they're relaying certain pieces of information. This also means behaviorally. How is this person behaving when they're speaking about certain things? Are they fidgety? Are they quiet? Are they distant? Are they engaged? These are cues that the therapist will use to be able to pick up and use as the assessment in regards to the therapy and how the therapist can help the client. McCullough 2021 also goes on to state that the individual is isolated interpersonally. Sometimes they may talk in a monologue manner using a well-rehearsed script of rejection. And sometimes their lives are in quiet despair within a self-contained world. And so we see how this particular instance of having the friction in the interpersonal relationship causes a person to go into isolation. And sometimes even forms of rejection that might come from the breakdown of interpersonal skills that the client may have, which thus leads them into this form of depression, which can be chronic over the course of time. With this, I want to speak about some of the goals for the therapy of CBASP. And with this, one of the things that we must understand is that patients are unaware that their primitive verbal thoughts and behavior patterns serve to keep them perpetually disconnected from the environment. This is very important when it comes to the goals of therapy. A person may not understand that they are almost self-sabotaging themselves when it comes to their interpersonal relationships. And this is something that the therapist must address with the client so that they have a better understanding of why they are falling into this pattern of negative interpersonal relationships and having negative interpersonal skills and speaking in a negative way and behaving in a negative way. And so this would be one of the goals that would be addressed in therapy. How do we allow the person to understand, to know that they are functioning in a negative downward spiral? We also must understand that this means that the client is also unresponsive to environmental consequences and feedback, which means that they may not be picking up on social cues. And so that might be another goal in therapy, is helping the client understand the social cues to their negative speaking patterns and their negative behavior patterns. In this, we must understand that CBASP seeks to remedy this perpetual deficit according to McCullough 2003, and to replace their disconnectedness with perceived functionality and with an expectation that would denote and denounce the consequences of their behavior. And so the goal is to ensure that the client walks away with understanding how do they remedy these negative interpersonal relationship skill patterns that they have. How do they remedy the negative interpersonal speaking language that they have, so that they can become reacclimated again in more positive and holistic interpersonal relationships. This is done according to McCullough 2020, through the removal of traumatic developmental history. It is done through the removal of pervasive social avoidance. It is done through generalized interpersonal withdrawal and detachment, being allowing the person to understand what is causing these things and when they do these things. It is also comes from the removal of anger towards one or more significant others, the removal of overwhelming feelings of helplessness as well as hopelessness, the removal of generalized pessimistic views that nothing can ever be different, removal of suicidal ideations that may also include suicidal attempts because of the rejection and the removal from interpersonal relationships. It also talks about the removal of feeling unlovable and that no one could ever love them. And all of these components is what causes a person to spiral into the major depressive disorder and into the persistent depressive disorder and into chronic depression. And so if we can remove these things that the client is feeling and put them onto a better path of understanding that they are capable of love, they are capable of having wonderful interpersonal relationships, being able to work and heal through the trauma of developmental histories, as well as releasing the anger that they may have towards themselves and others through freedom of forgiveness. This will also help in the goal processing and in the treatment processing of the chronic depression, as well as the PDD, as well as the MDD. With this, those are some of the examples that can be demonstrated in the therapy process. Another piece is the dystemic disorder. This is another disorder that can be helped by CBASP, according to McCullough, 1984. With this, I want to indicate that McCullough 2003 has indicated that this theory, CBASP, is an empirically supported psychotherapy designed to treat chronically depressed adults. And because we know that depression knows no limits, it knows no age, it knows no gender, it knows no ethnicity, we are able to see that anybody that is diagnosed with these particular diagnosis can receive the support and treatment they need. With this, I believe and I surmise that this in turn falls in line with the Christian worldview according to Romans 12:2 from the Amplified Version, and it says, "Do not be conformed to this world any longer with its superficial values and customs, but be transformed and progressively changed as you mature spiritually by the renewing of your mind, focusing on godly values and ethical attitudes, so that you may prove for yourself what the will of God is, that which is good and acceptable and perfect in his plan and purpose for you." And so as we align CBAST, which is cognitive behavioral analysis system of psychotherapy, along with this Christian worldview of Romans 12:2, I believe that this can help those that are suffering with PDD, MDD, and chronic depression in the renewing of their mind. Because that is what this process is about. It's about renewing their mind to remove the negative thinking, behavioral, and thought patterns, and then depositing positive thought processes, behavioral patterns, and interpersonal skills. And so this, along in conjunction, can help those that we support with this diagnosis. I also would like to read Philippians chapter 4, verse 8 from the New Living Translation, which says, "And now, dear brothers and sisters, one final thing. Fix your thoughts on what is true and honorable and right and pure and lovely and admirable. Think about things that are excellent and worthy of praise." And so as a person begins to incorporate their Christian worldview with CBASP, this will help the person to be able to take their cares to the Lord, to cast their anxieties to the Lord. And as they're able to do such, they in themselves will begin to renew themselves with the mind of God, with the scriptures, with the word, so that they can begin to think on those things which are lovely and pure and honorable, removing those negative thought patterns and replacing them with those things that are good and honorable, and being able to change those behavioral patterns so that they are changing into the mind and the behavioral of Christ-likeness. And so with this is part of the treatment and the goal processing of CBASP. And then finally, I wanted to indicate that in this theory, that this has two major operational functionalities when it comes to treatment. The first one is felt didactic safety and perceived functionality, according to McCullough 2020. And this is acquired over the process of therapy. And I must stop here to say that therapy is not a short-term fix, but it is a duration of time in which we are removing one, which is the old, and replacing it with the new. And so this is done through a process of time in order to ensure that the client is not overwhelmed or bombarded by what they are changing in this process, but in understanding that through the course of time, these changes will take place. And as they take place, they will also take root in the mind and the heart and the spirit of the person. Lastly, I must say here that one word of caution, according to McCullough 2020, is that it is the author, which is again McCullough 2020's firm belief that the onset of PDD is never fully cured. However, CBASP therapy is an endeavor striving to educate, because we must understand this is education, and educate patients how to manage the lifelong disorder. And with that, that gives hope to say that they are not helpless and they are not hopeless, but that there is hope with the coupling of therapy along with the Word of God and their Christian worldview, that they can help be brought together to have the greatness of interpersonal relationships, the removal of negative thoughts and patterns and behaviors, to be more well-rounded and holistic wellness according to the Word, and lastly, to have a well-rounded quality of life. And I believe that some of the key resources that will continue to help a person as they continue to work through CBASP is the Word of the Lord. The Word of the Lord is our strong foundation. It is what we need to live this life so that we can have holistic health, peace, joy, love, patience. Another resource is obtaining bibliography in regards to CBASP, so that as new information is becoming aware and available, they can understand that there are techniques that they can implement into the lives of the patients so that they can be able to have well-rounded life. I also believe that another resource would also be continuing education to make sure that they are kept abreast of the new and upcoming trainings, as well as tools that can be used to support a person as they are going through this. But lastly, but definitely not least, I believe that the counselor must always rely on the Holy Spirit. And the reason why I say this is because there is no one person that is the same. And because no one person is the same, we must rely on the Holy Spirit to give us grace, understanding, knowledge, and wisdom to be able to support every person that comes to us, so that as we are helping them, we are also leading them back to Christ, so that they themselves can have the ultimate and personal relationship with the Lord and with God the Father. Thank you so much for listening.